Okay, members, the first bill on our agenda is House File 338. We heard this bill last year, but I believe there is a technical amendment, and Representative Cleaborn, welcome back to our committee. Would you like to adopt the technical amendment and then discuss your bill?
Yes, Madam Chair, I would appreciate that.
Okay, I'm going to move the A1 amendment, and we'll take a voice vote. All those in favor of adopting the A1 amendment, please say aye.
Aye.
Any opposed? Okay, the motion prevails and the A1 amendment is adopted. Representative Cleaborn, to your bill as amended. And the motion is to lay House File 338 as amended over for possible inclusion in our Human Services Omnibus bill. Representative Cleaborn.
Thank you, Madam Chair. And just for the committee members, if they haven't had a chance to review the amendment, all it does is change 2 dates. The first date is the report for the Legislative Committee, and the second date is for the date of the appropriation. And I would just like to give the committee a quick reminder as to the content of House File 338. It requires HealthForce Minnesota at Winona State to develop a pilot project establishing the Minnesota Direct Care Service Corps with financial incentives and minimum work requirements. It also establishes pilot sites, locations, and duties, and it requires an evaluation and a report. The bill as amended would appropriate $500,000 from the general fund to the Commissioner of Human Services. And with that, Madam Chair, Diane Drost is with me today, and she would just like to speak briefly to the importance of the need for the establishment of the Direct Care Service Corps pilot project. So with that, I ask you to please recognize Ms. Drost.
Thank you, Representative Cleaborn. Welcome to the committee, Ms. Drost. Please introduce yourself and then continue with your testimony. Oops, you're muted.
Okay, start again. Thank you, Madam Chair, for allowing me to testify. My name is Diane Drost. My address is 4722 Barber Drive, Minnetonka. I am here to ask for support of our bill, the Minnesota Direct Care Service Corps pilot. I'm a member of Women Standing Strong, which is a spinal cord injury group, support group for women who are supporting their adult children with spinal cord injuries. But I'm also a member of the cross-agency Direct Care and Support Workforce Shortage Group and the Metropolitan Center for Independent Living's Community Innovation PCA project. My daughter Sam sustained a high level of spinal cord injury, resulting in quadriplegia a year after her first year of college. She is approved for personal care assistance support of 11 hours per day, but currently she's only been able to recruit one person who works 6 hours a week. My husband and I cover the rest of her hours. Because Sam is a quadriplegic and has significant physical and health needs, she also actually qualifies for nursing support. However, this too has been affected by the home care shortage. And last month, her agency actually has said to her she would need to sign off on where she would like to go if Greg and I no longer can provide care. Her choices were to a hospital or to a group home. So I've watched Sam as she has attempted to hire caregivers. Often we're beat out by other large healthcare employers in terms of hourly pay, hiring bonuses, scholarship, loan forgiveness programs, and other incentives. Even those people who want to work in home care prefer working with people who have less needs like Sam. We need a lot of solutions to solve this problem. The recommendations to establish the service corps have been included in several reports, and I think that I've spoken to those in the past. The time has come for us to really look towards college students for help in caring for our people. We believe that we can mobilize an entire generation of student workers to the field by offering them the opportunity to become part of a service corps. In addition, these students would also have the opportunity to receive an hourly pay for the part-time work. We understand that if our service corps pilot program is successful, we need to look at ways to sustain it going into the future. So as part of the work that we are doing, we've connected with Serve Minnesota, and we are in the process of collaborating with them on our model to see if this is a possibility. So I thank you for listening to me. I want to be very brief because I know most people have heard all about the workforce shortage, but I really want to stress how important it is that we keep these people living in their homes and communities. The choice between going into a hospital or a group home is beyond even my belief. I mean, Sam is a vibrant young woman. She works as a data scientist at Target. She contributes to her community. And Greg and I are both getting older. So this is a real scary situation for us and for her, as many people. And anybody can sustain an injury or develop an illness, which results in a physical and health disability like Sam. Thank you for your time.
Thank you, Ms. Drost, and thank you, Representative Cleavorn, for bringing this bill back. It's an important bill. We need to be creative about how we increase the pipeline for PCAs and direct support professionals. So I think it's a great bill. Are there any questions for the bill author or the testifier? Representative Albright.
Thank you, Madam Chair. Good morning, Representative Cleavorn. You mentioned the HealthForce Minnesota, and I know that they have implemented programs in the past, and I'm wondering if you could give a summary in terms of the programs that they currently provide, and if there are any success stories that you'd like to highlight.
Representative Cleavorn.
Thank you, Representative Albright. Unfortunately, I did not come prepared to speak to HealthForce Minnesota. They are a highly qualified program through our Minnesota state system. And I'm happy to provide that information for you at a later date. I do not believe that we have Mr. Four on the call today. Is Valerie on the call today?
Valerie is not on the call. She's out of state.
Okay, thank you very much. Representative Albright, I'm happy to get some of that information to you if you want to send me an email for the concerns that you have. Thank you.
Representative Albright, maybe if we have time this session, we can get an overview of the HealthForce Minnesota work and committee. Representative Albright?
Yeah, thank you, Madam Chair. And that's unfortunate because this is, I think you have to understand the context in which you're suggesting that a new program be implemented based upon what is already in place. And so I guess my next question would have been, and maybe it still might be in terms of, you're referring to the March 2018 report that talks about, expanding, diversifying, and improving Minnesota's direct care workforce. So help me understand why a program with $500,000, even with a $25,000 max on the admin, is going to assist in a pilot program. What are the objective measurements that you hope to identify by this general fund expenditure?
Representative Cleavorn?
Thank you, Representative Albright. I just would like to refer you back to the February 9th, 2021 testimony at that time of Mr. Four. I believe you asked many of these same questions and she answered them at that time. So it's possible that you already have the answers to these questions in your notes from before.
Representative Albright?
That seems like an eternity to go, Representative Cleavorn. And so I'm just trying to remind myself of what we're talking about in the context of this bill. So, and I hope that, we don't get into a contest of, referring back to prior testimony, even though this bill was heard in committee some time ago. I think it's important that you remind the committee of what the purpose of this bill is and why you feel it should be included in the omnibus bill. And given that, that's why I'm asking these questions. So please summarize, and rather than referring me back to testimony that I probably would take 3 days to find anyway.
Representative Cleavorn?
Thank you, Representative Albright. And what I would say to you is this: the bill is very simple. It's very clear. It establishes, and I believe that Ms. Drost answered the questions pretty clearly. We have an overwhelming need for PCAs at this time in our state. This is an opportunity for us to do two things. One, to help create a workforce going forward with the aid of HealthForce Minnesota at Winona State, to help us create pilot programs to see if we can help create a workforce for PCAs. In my own community right now, we have group homes that are also getting ready to shutter because we have no people to care for individuals who are living with profound physical disabilities. It is a time for us to be creative and for us to enlighten a whole new generation of individuals about the possibility of doing service this way while getting their college degrees. And maybe even it will help with the the workforce shortage that we have in the healthcare industry as a whole. I don't understand which piece of the bill that you don't understand. It's very clear, it's very simple as to what we're doing. And I would be happy to meet with you and come to your office and talk with you about this in greater detail. Thank you. And I would be happy to do a Zoom with Ms. DeFore when she's back in the state.
Thank you, Representative Cleburne. I do recall that testimony and a lot of support from Winona and the system, Minnesota State system for this program. And I don't believe they thought it was duplicating any existing program. Representative Albright.
Evidently, my internet connection is a bit unstable. I did not hear the response from Representative Cleburne, but suffice to say, ambiguity is not the friend of legislation. So at some point, I do hope that there's brought a little more clarity brought to this in terms of it's nice and platitudes, suffice to say, utilizing financial incentives. We're going to, put $500,000 towards figuring something out. I think there needs to be a little more clarity in terms of what those programs might be. What is the desire for $500,000 of taxpayer money being spent on a program without having us understand what that really looks like, what you hope to achieve, what's the scope of the pilot program, other than to identify it as we want to figure out how to attract students to be PCAs. Great idea, but help me understand in future a little more in terms of what the scope of that really means. I need a little more definition. I'll end it with that.
Thank you, Representative Albright. Representative Robbins.
Excuse me, Madam Chair. May I
Sure,
just?
Representative Cleburne.
I again would like to refer Representative Albright back to the materials that were presented in February of 2021. There was an entire work plan that was provided to the committee at that time when we vetted the bill in full. Again, this is a bill that the committee has discussed, debated in full in February of 2021. My reason for coming here today is to extend 2 dates. Thank you, Madam Chair.
Thank you, Representative Cleburne. And I will remind the public that bills that were introduced last year are still alive. And so we are just bringing this bill back to update the dates in the amendment. And this bill was not included in our last HHS omnibus bill. And we're hoping to possibly include it in this year's bill. Representative Robbins.
Thank you, Madam Chair, and thank you, Representative Cleburne. Yeah, I have a follow-up question with information since we heard this last year. So my parents live in an older community, and one of their neighbors actually participates in a program where they have a college student come in and do this care. And I honestly don't know what program it's with, but it already exists. And when I was at the Our State, Our Future conference at the University of Minnesota last week, there was flyers in the building at the Humphrey School with little tear-offs where they were encouraging college students to sign up to be PCAs. So I didn't know about those things last year, but clearly either through the private sector or through an existing program, this is already going on, and college students get paid and they're encouraged. You didn't have to be in the major of going into the healthcare field. It was open to any major. So I just wondered, I'm a little leery of, now that I know more about this, creating a pilot program when it seems like this is already happening. So I don't know if it's happening just in the private sector or if there's already existing pilot programs, but I would like more information before this gets included in the final omnibus, because if this is already going on, I'd like to, we have limited resources, target it either towards an existing program that's happening or just, decide, this is already going on, we're okay with it. So any follow-up you have on that would be great. Thank you.
Representative Cleburne.
Thank you, Madam Chair. And to Representative Robbins, there are PCAs and there are PCAs, and they not all PCAs do the same work. And I would say to you, for the individuals that we are discussing today and that have come to me in our community asking for this pilot core, these are individuals who have profound health issues. The individuals who care for them must be trained in life-threatening instances that could arise at any moment. And that is why we want to make sure that the people who are serving as PCAs are trained, who have the qualifications to go into these homes. And the reason that college students, and I'm really glad to hear about the program that you were discussing, more is better, but we need to make sure that everyone who is serving as a PCA really has the tools and the experience necessary to be able to care for these individuals. And the individuals living with quadriplegia that I have worked with really like having college students. They are of the same age. They can intellectually communicate and relate to them. They understand the importance of acting quickly and responding on their feet. And they have the intellectual curiosity to understand and to find out what is going on and why. So I would say more is better. And thank you for your comments.
Representative Robbins.
Thank you, Madam Chair, and thank you, Representative Cleaborn. And I appreciate that training is necessary, but the bill says the pilot must utilize financial incentives to attract post-secondary students to work as PCAs or direct support professionals. It doesn't really indicate anything about what level of training they would be required to have. So if you want to target it towards specific training, you know, maybe that's something we could add down the road, but the bill as stands just seems like about it providing financial incentives for anyone in this field. So, and I agree, young people are great. They relate to older people, but my nephew also has special needs and he has a PCA and he loves when it's someone his age. He feels like they're cool. He loves hanging out with them. It's more of a social engagement for him. So I totally get it, but I just want to make sure that we're using resources wisely. So thank you.
And I would agree with using resources wisely. Thank you.
And I'll just add that we have a need of over, I think there's 13,000 slots available for PCAs in the state. And so I think having multiple avenues, pathways to become a PCA is probably more ideal than just one. And I am familiar with these recruitment advertisements on campus. I have a lot of current students that work in group homes. And so I think it's a lot of private sector providers that are trying to solicit college students to work. And I'm not that familiar with how much they're getting trained to work in group homes. And I think the program that Representative Cleaborn is trying to create is more for individual PCAs that would work with individual clients rather than necessarily in group homes. But I see another question from Representative Keel.
Thank you, Madam Chair. I'm a little disturbed about the conversation. I think that PCAs are very important. I have watched people that get very little training that are very successful and knowledgeable about taking care of people. I also think that there are nurses, aides in nursing homes that need more training. Okay, let's just put it that way. I won't go into any stories. However, Representative Cleaborn, my concern is your response to Representative Albright that we can just look back. We have public listening to this right now. They certainly want to know, what does this mean for them and their family? What are they looking at? What do they need? And I think we really need to make sure that we're explaining to people what we're doing with this money, because while the pilot program might be in certain areas, it doesn't mean it can't be in others. I've got nursing homes that run pilot of their own programs, and they've been funded a little bit now in nursing home care, but a lot of my PCAs that I know are doing both. They're in a nursing home, they're doing PCA services. And so I appreciate that we've talked about this before, But I think we have to remember, we have a lot of people listening that are saying, gee, you know, what would this do for me? So we need to make sure that we have that background, because they're going to have a heck of a time trying to find the data from last year. You know, I just want us to be really careful about referring back and making sure that people understand Minnesota's a big state. There's a lot of things that can happen here, but maybe the pilot program works well for some areas, but we need to know the detail. And even if it's 500,000 or we're spending $50 on it, we need to know where that dollars go and how effective it will be. So, and how important it is that we are doing the right things so that we can get as many personal care attendance services that people need. So thank you, Madam Chair. And
Thank you, Representative Keel. Representative Cleaborn.
I understand. I see that Ms. Strauss has tried to raise her hand several times. If we could go to her and let her
Sure.
speak to the issue, since she's impacted personally.
Ms. Drost.
Thank you, Madam Chair. I have before me the Minnesota State HealthForce Center of Excellence proposal that was written by Valerie DeFore, and I would be glad to send it to you and you can disseminate it through the committee. I can speak to the goals that are on here, the pilot outline, and how the evaluation will take place. And secondly, one of the things that I mentioned were references to 3 recommendations from 3 different groups. And what they have found is, yes, there's scholarships out there, there's incentives, there's loan forgiveness. It all depends on what agency and organization you're going through. When we drilled down, when we prepared the report for the Olmsted Subcommittee, one of the suggestions was to develop a service corps to expand the workforce. The reason for that is no one goes into home care working with this particular population. They are the lowest paid of anybody in the health support area as far as home care. If you want to work in a nursing home or with the elderly, they get a totally different funding resource. If you're working in group homes, that's a totally different funding resource. There are many, many wonderful programs in our state that as a parent, when I went in, I thought, oh my gosh, this is wonderful. Look at all the programs out there to support people who want to work with people like Sam. And even when I called about the community-based home, it was a community-based scholarship program through home and community-based services for people living in their own homes. What I discovered was that is only for people over the age of 65, or if you have a developmental disability. So yes, there are many programs out there. There's places all over the place. We have campus fairs, depending on what disability you are. There's events. There's tons and tons of recruitment opportunities out there to get people to work in the field. However, the one group that isn't out there is our group. It's people living at home by themselves. They're very isolated. They work with small home care agencies. Our agencies don't have access to all of those programs. That is why this suggestion of developing a service corps was placed in the recommendations that have been given to the sub-cabinet of Olmsted, and also at the summit in 2016 that DHS sponsored. DHS sponsored the cross-agency group, and now there's even another group that I'm working on that is trying to carry this out. So there's, if you'd like the copy from Valerie, I can send it over. I can fax it to Ginny and she can disseminate it. Or if you'd like me to read the goals, I'd be glad to do that right now.
Thank you, Ms. Drost. If you can send that, we can forward it to committee members. Representative Cleaborn.
Yeah, and I would just like to reference that the work plan that Ms. Drost is referencing is the Olmsted Subcabinet dated July 16th, 2018.
Thank you, Representative Cleaborn. Representative Fisher.
Thank you, Madam Chair. And I would like to say thank you to Representative Claiborne and Ms. Drost for being here today to talk about the bill and present it. One of the things that I very much appreciate is the part of the bill that is taking a look at the evaluation report. And I know Ms. Drost highlighted on that a little bit. And one of the key things I think is going to be very helpful is when the report comes out, it's also going to be talking about retention issues. And I
Mhm.
think that is one of the key things to be able to have this pilot done and to be able to have an evaluation report coming out and saying what's being effective and what isn't. We know we've got many challenges out there, and sounds like a perfect time to be able to get something like this through. So I want to say thank you for bringing this back forward to us. Thank you for the explanation, and thank you for having a great evaluation and reporting mechanism built into this to make sure that we have the accountability in there. Thank you.
Thank you.
Thank you for that comment, Representative Fisher. And I'll just remind the public that HHS, we spend $16 billion on our budget. So this request is very, very minimal compared to our total budget for HHS. Let's see, I'm not seeing any more questions. Representative Gill, your hand is up. Did you have another question? No. Okay, Representative Cleavorn, final comments.
Thank you, Madam Chair and members of the committee for letting us bring this bill back forward and amending these dates in the bill. And I'm happy to always be available to you at any time to answer any questions that you might have. Thank you very much.
Thank you, Representative Cleavorn, and thank you, Mr. Roast, for being here today. So I'm going to renew my motion to lay over House File 338 as amended for possible inclusion in our Human Services Finance and Policy Omnibus Bill.